технологічна, дуже довга оцінка ризику раннього інфікування ВІЛ жінками комерційного сексу та значення для протидії епідемії ВІЛ. Ми його між собою називаємо транзитний проєкт. Маріса буде трошки пояснювати, чому це так. Ви маєте нашу програму, і я дуже хочу вас залучити, щоб ви з нами попрацювали сьогодні всі разом до кінця дня, тому що саме цікаве у нас буде наприкінці результати, саме епідеміологічні результати і обговорення, що це означає для епідемії. Тому я дуже прошу скерувати ваші можливості так, щоб ми сьогодні могли попрацювати. Я зараз запрошую до вітального слова Джеймса Бланча, який представляє Центр глобального громадського здоров'я університету МАНІТОБИ, Канада.
Thank you very much, Olga, and thank you for all of the organizers of this meeting. So I'm going to be brief, and I'll just start with a few thank yous. So I first want to thank particularly Olga and Dasha from the Ukrainian Institute for Social Research for the excellent work that they've done in this project. I think you'll find today really important findings, and I think it's due to the very good work that they've done. Also, the community implementing partners, Veritas, who have been really indispensable in this work. I think we have to recognize the excellent work of their organization. I also want to thank public health officials and the Alliance, because I think all of these organizations have worked very hard to put together this important research project. So as Olga indicated, today you'll be talking about some of the key findings from this Transitions project. And the Transitions project, the idea for this project arose from a number of experiences that we had our university, our Center for Global Public had around the world, in Asia, in Africa, in Europe, and also in parts of North America. And it really created two themes. One theme is trying to understand the risk of acquisition of HIV that occurred particularly earlier among young women and adolescents. And the second is to understand better the risk for HIV and other sexually transmitted infections that are occurring among those who aren't formally associated with the key population. So those two ideas, one is how can we understand what's happening earlier in young women's lives, and how can we understand outside of the formal most at-risk populations. And one of the reasons I can illustrate for the reason that we're interested in this issue of early risk is that in study after study that we've conducted or looked at, and in our programs that we've implemented globally, we almost always find that HIV prevalence is very high, very early after sex workers begin in sex work. So for example, we implemented a very effective program for HIV prevention among sex workers in India. But still we found that within the first year of sex work, about 15 to 20% of sex workers were already HIV positive. And our very good programs usually only reached the sex workers after they were infected. So we were too late. And so we recognized we needed to try to understand how we could start our programs earlier before programs normally are reaching women in sex work. The second observation is, especially our work in parts of Nairobi and in parts of Nigeria, we recognize that there's a lot of overlapping of risks. So if you go to venues where there are sex workers or other places, there's not just sex workers there, there's other women. There's women who are having transactional sex, there's women who are being casual partners. So this idea of just having a program for sex workers raised questions in our minds as to whether we were missing something in terms of risk, which was another motivation for this research. So the two key issues that have emerged, and I think you'll be talking about them today, is one, that risk starts early. And so that we need to really understand when that risk is occurring and we need to move ahead. And the second thing is that risk is not just about behavior. It's also about the context in which people are living, interacting, and sharing their lives, their ideas, and their behaviors. And so it's very important to understand not just the behaviors, but also the spaces that people are living in, and the networks, the social networks that they have. Very, very important for us to understand. And I think that as you look at the data and as you talk about the data today, I would really encourage everybody to fundamentally think about how we could reshape prevention programs, whether they're just for sex workers or whether they're for a wider group of young women. How can we reshape the way we think about prevention in light of the findings that are emerging from this transitions project? And particularly think about how we can focus our prevention efforts, not just at certain periods of people's lives when they're at most at risk, early in their lives, but also focusing our efforts to those places, those contexts, those networks where there's a lot of possibility of transmission. So I think this is an incredibly important study. It's an important study for Dnipropetrovsk. It's an important study for Ukraine. But it's an important study globally because I think we're discovering things, and we'll continue to discover things from the work here that will really have an opportunity for us to emphasize new ways of approaching HIV prevention in other parts of the world as well. So we really anticipate that you'll be discussing things about Ukraine and the implications for Ukraine here, but these findings will have global significance as well. So I wanted to thank everybody for coming. I hope that the deliberations will be fruitful, not just for the programs here, but for our insights overall. I'll also apologize in advance. Unfortunately, I have to travel back to my home country, Canada, later this morning, so I won't be with you the whole day. I'll have to leave before you. But I've had a few days meeting with the team, and it's been very encouraging to see how fantastic the team is and how dedicated they are to getting the right results. Thank you very much.
Дякую, Джеймс, за таке ґрунтовне вступне слово. Мені навіть нема необхідності говорити про мету і завдання нашого круглого столу, бо ми зараз розуміємо. Я з свого боку теж хочу подякувати всіх партнерів і, перш за все, партнерів канадської нашої команди. Я хочу представити Марісу Бекер, яка також представляє Центр глобального здоров'я університету МАНІТОБИ. І вона була одним з ініціаторів цього проєкту і один з керівників цього проєкту. Попрошу її представити канадську команду, з якою ми працюємо і маємо надію працювати ще наступні 3, 4, 5, залежно від ситуації років.
Thank you, Olga, and good morning to everyone. And we're also hoping to work for 3, 5, and many more years beyond that together. As Jamie said, it's been such a fantastic partnership, and so we're really grateful for that. I'm happy to introduce our team. You've met Jamie already, who's the director of our center and really one of the early thinkers around this project and some of the important guiding frameworks and philosophies to the project. And I'll just go to my right and around Rob Lorway from the Center for Global Public Health at the University of Manitoba. Rob's a social scientist and is going to be really instrumental in leading our next project together. Sharmista Mishra from the University of Toronto, and Sharmista's been working with our group for many, many years, and we've had lots of fantastic collaborations together. Sharmista is a mathematical modeler and will be leading the modeling work for this project as we go forward, as well as our next collaborations together. Doris Kuzma is to Sharmista's right, and Doris is our Senior Program Manager at the Center for Global Public Health and is really so critical to the operations of our center and our work here in Ukraine as well as our other work globally.